you are taking metformin and you are experiencing those side effects and they don't improve after weeks to a month, you can consider asking your provider if berberine is a good option for you. So berberine is generally well tolerated. However, you may experience some of the GI effects. Welcome back to the PCOS Holistic Coach podcast with me, Dr. Ami Patel, pharmacist, fellow sister, and coach. This podcast is an easy-to-listen-to resource for your busy, on-the-go life. You will learn how you can live a healthier and happier life with PCOS from real conversations about managing PCOS and the symptoms with amazing guest speakers. Hi, everyone. And this week, we're going to be talking about medications that can be supplements that can actually be substitutes for those medications. For example, like berberine is commonly used instead of metformin. Sometimes inositol is used instead of birth control in the sense of it helping improve insulin resistance. Obviously, inositol is not birth control. Please do not get that confused. It will not protect you from pregnancy. Actually, it can increase your fertility. It's actually quite the opposite in that sense. And sometimes zinc can be substituted for spironolactone because when I mean substituted, the results that metformin and berberine give are similar, whereas spironolactone and zinc also give similar effects, which we will be discussing. So first, I'm going to talk about, inositol is a brand name, but it's also, the generic is technically called inositol or inositols because it's made of myo-inositol and D-chiro-inositol. And these are basically vitamins that are found in fruits and beans, and they are all in all of our cell membranes. However, for those of us that have PCOS, sometimes we are deficient in the pathways that process this in the cells, and so that causes the insulin resistance. So if we supplement the inositols in the 40-1 ratio, which is 40 of the myo-inositol and 1 of the D-chiro-inositol, so that just means there's 40 times more of the myo-inositol. And that's really important because that's the natural ratio that is in our bodies and for our cells to function properly. So if that is supplemented, then it will improve insulin resistance. But as I was briefly mentioning, it does help with fertility in the sense that it improves egg quality and ovarian reserve. Also, it does improve mood and it can decrease the risk of postpartum depression. It's really well tolerated and it is actually safe to take in pregnancy as well. One of the few things, because it is just vitamins, but it is best to speak with your provider before taking any medications during pregnancy. And just a disclaimer about all of these medications and supplements that are discussed. I am a pharmacist, but please, this is more for educational purposes. Please work with a provider instead of just taking any of these supplements, medications on your own or even in combination. It can be dangerous if you overtake them, and if your body is used to a certain blood glucose level, and if it has sudden drops, it can be dangerous for your body if your cells aren't getting the glucose and the sugars that it needs, and if there isn't a gradual decrease over time. So it can be dangerous for you. So please do not just randomly take any medications and supplements without talking to a healthcare professional that's an expert. And with that being said, you can work with me in one-to-one coaching if you are interested in managing your PCOS. So with that disclaimer and side note on the side, back to talking about inositols. It is generally well tolerated, as I was mentioning. And so you have to be careful with the 40-1 ratio. That is key. And some supplements don't have that ratio. But a brand that I recommend and that I personally use is inositol by Theralogics, and they're a very reputable vitamin company, supplementation company, and their inositol is of high quality, so I would recommend getting it from there. I do have a code. I'm partnered with them, but I do not get any benefits or money back for the referral. You guys get $10 off, and it's not a discount savings. It's under provider referral code, and the code is 611030. 611030. Yeah, so it's PRC code 611030. So like I said, I don't get any benefits from you guys taking that. If you work with someone and they recommend you take it and you choose to take the Theralogics brand of the inositol, then you can use that if you would like. So the next one is berberine that we're going to be talking about. So berberine is actually a Chinese herb, and it activates a protein which is important in the pathway for metabolism, and it activates something called the AMP protein kinase, and that improves insulin resistance. So some people, like I was mentioning last week, may not tolerate metformin as well, having a lot of upset stomach, nausea, vomiting, things like that. So if you are taking metformin and you are experiencing those side effects and they don't improve after weeks to a month, you can consider asking your provider if berberine is a good option for you.
Living with PCOS has been a lonely experience for me. I've felt even more alone around the holidays. Although the holidays can be full of fun and special memories, they've also been filled with anxiety about comments people may make about my weight when I'm planning to have kids or any of my other PCOS symptoms. The holidays have been a stressful time with travel, food at holiday parties, and just being out of my usual routine, which manages my PCOS. Over the years, I've learned how to get through the holidays while being in control of my PCOS. Now, you don't have to go through this upcoming holiday season alone or stressed. I am launching a PCOS holistic healing community in October 2023. Inside the community, you can connect with like-minded individuals who also want to prioritize taking control of their PCOS, monthly educational sessions followed by Q&As, participate in guest expert interviews, and have one-to-one coaching support from me. Submit your information via the Google form linked in the description to learn more and save your spot inside this exclusive community. Now, back to the episode.
So berberine is generally well tolerated. However, you may experience some of the GI effects, such as like nausea, vomiting, diarrhea, bloating, upset stomach initially, but it should subside and it is milder than metformin. There is not enough evidence to say that berberine is safe during pregnancy, so it's not recommended to be used in pregnancy, whereas metformin is actually compatible or safe to take during pregnancy, so that can be helpful to prevent or treat gestational diabetes if someone does develop that. So those are some things about berberine. It is best to be taken before meals because it works with digesting your food, and not like digesting your food, but since you eat, it helps with the insulin resistance and that at that time because you have just eaten. So it's best to be taken before meals. And another benefit of berberine is that it can actually help improve your lipid panel, like increase your HDL, decrease your LDL and triglycerides and total cholesterol, which for people that have PCOS, people that have PCOS may have abnormal lipid panel, which are the labs that I was just saying. Therefore, berberine can also help with that. So that's a brief description of berberine. And lastly, I'm going to be talking about zinc. So zinc is a natural androgen blocker, which means that it works by decreasing testosterone. So androgen is male hormones, and an example of that is testosterone. And testosterone turns into something called dihydrotestosterone, DHT. But if with zinc, it naturally reduces that, and having high testosterone in people that have PCOS can cause certain symptoms like acne and facial hair. That's why sometimes zinc can be a supplement that improves those symptoms. And zinc is found naturally in foods, but zinc deficiency is more common with plant-based diets because plant foods are low in zinc. And some examples of zinc deficiency can be hair loss, inflammation of like not sensitive skin, but inflammation or rashes or things like that on the skin, an impaired immune system, and white spots on the fingernails. But you may still have things like acne or, facial hair without having a zinc deficiency, because being deficient doesn't mean that you have acne and facial hair. That's just because of the high testosterone, but zinc can help decrease that naturally. Also, zinc interferes with, the absorption of zinc is interfered by certain things like alcohol, stomach medications, having hypothyroidism, and taking birth control. So, once again, that's why I mentioned it's best if you discuss or work with a provider before just taking like random supplements and medications and then getting frustrated that things aren't working and just spending a bunch of money and not really seeing results. Zinc is generally well tolerated, and there isn't information to say whether it's safe to take or not take with pregnancy. And once again, that is best discussed with an OBGYN or a healthcare professional. So with that being said, after you guys watch this, if you have any questions, please leave them in the community and I will get back to you guys with answers. But yeah, as always, be kind to yourself, be patient, and focus on progress, not perfection. And I will see you guys next time.
If you loved this conversation and want to participate in live conversations with guest experts, be sure to join the PCOS Holistic Healing community. If you're listening on the podcast, please leave a review. If you're watching on YouTube, be sure to leave a comment or any questions you have for the guests. Connect with me on social media. My handle is at pcos.holistic.coach. Send me a DM and say, hey, I'll catch you in the next one.